I'm Lawson Wulsin. I'm the author of Toxic Stress. I'm a psychiatrist by profession, and I have spent my career both teaching and studying mind-body questions. I've been training resident physicians to become both primary care physicians and psychiatrists, and I've spent my research career trying to think about how things like depression turn into heart disease and how stress leads to various kinds of illnesses. And so writing this book has been a passion of mine for probably the last 10 years. I started working on it about 6 years ago because I think that stress is one of the most fascinating mysteries. You know, it's a bit like the climate. There's a good joke about an old fish swimming in water, and it passes two young fish swimming the other way. And he asks these young fish, "How's the water?" And after the old fish swims by, the younger fish says to the other one, "What's water?" And the point of the joke is that stress is so pervasive and so all around us that we have a hard time even noticing it, unless it's really extreme. And we have a hard time measuring it. It's a little bit like climate change that way, or any other really complex fact about our environment. And so working as a physician in primary care settings, as well as even in psychiatric settings, it's very common for people to talk about stress and then forget about it in the clinical encounter. In other words, it's something that we intuitively know, but doctors are not very good at measuring it, not very good at treating it. And so it's really not a very common part of anybody's treatment plan for common chronic illnesses that are stress related and made so much worse by toxic stress. Toxic stress really begins with the dilemma we all have of trying to understand how stress in our daily lives turns into illness that can either slow us down or even kill us early. And that involves learning how to differentiate between good, tolerable, and toxic stress. In other words, stress, even though most of us think of it as bad, is actually inevitable, unavoidable, and quite good for us in many ways in small doses. So, you know, evolution has given us this stress response system, which is a enormously complex system of systems, all of which self-regulate, and it happens automatically, you know, even little babies. This stress response system is working at the time of birth. And as we grow, it becomes even more elaborate and more complicated, with the central nervous system being the commander. You can think of it a bit like an orchestra. And the conductor of the orchestra is the central nervous system. But imagine trying to coordinate all the functions of the heart and the lungs and the gut and the immune system and the skin and the muscles and the nerves. It's enormously complex, and yet we don't think twice about it. It happens automatically every day until it gets out of whack, dysregulated, doesn't work very well. And that's what we call initially distress or discomfort. And eventually, if we don't get it in line again and get it re-regulated, we end up developing illnesses that may take on a life of their own. And, you know, in extreme cases, something as stressful as severe depression will cut 10 or 15 years off of your lifespan compared to your sibling who doesn't struggle with depression. And so it's a very costly process over the lifespan. And yet, in the course of a single week or a few months, we may not even be aware of this whittling away at our stress response system. And it's So one of the interesting things about my job is that I have spent a lot of time working in primary care settings as a psychiatrist. And when I go to my professional meetings, I am surrounded by people who are convinced that stress is a major factor in the development of most chronic conditions like high blood pressure, or diabetes, or obesity, or heart disease. But when I come back to working in primary care settings, most of my primary care colleagues don't spend any of their time measuring stress or treating it, because the guidelines for treating diabetes or heart disease hardly mention stress as a contributing factor to the onset or the progression of any of these common conditions. And I got wondering, why is this happening? How could we be ignoring something that's so important? And why is this happening all over the world and in very high-powered medical centers as well as rural, sort of under-resourced medical settings? And one of the answers is that the stress response system is a very complicated system, of course, and it's very hard to measure. And stress neuroscience has only been around for about 50 years. That may seem like a long time to some of you, but cognitive neuroscience, the study of intelligence, has been around for 100 years. And yet we only just 20 or 30 years ago developed a comprehensive way of assessing various kinds of intelligence. Stress neuroscience still hasn't come up with a comprehensive way of assessing the sort of total stress profile that anybody has experienced, either currently or preferably across the lifespan. We're still trying to figure out how can we measure the kinds of stressors that people are struggling with right now or in the last few months. And if you think about it, what really matters is not just what storm you're navigating right now, but how many storms in your life have you navigated? And have you grown up in a stormy environment, a stormy family, stormy internal physiology? All of that will accelerate aging, contribute to the development of these stress-related diseases, and sometimes shorten your life by 10 or 20 years. So I wrote this book primarily to foster conversations between people who have stress-related conditions and the people who take care of them. And this includes the family members of people who have these common chronic conditions and are wondering, what can I do about them? And one of the few things we can do about complicated illnesses like heart disease and diabetes and obesity is adjust the amount and the kinds of stress that we're exposed to and increase our resilience, our ability to withstand life's burdens and challenges. And so I'm hoping that the people who read this book will be people who are living with chronic illnesses that are well known to be stress related, or people who are living with people who have these illnesses, and the clinicians that take care of them. A lot of these conversations get initiated by patients who are asking the people who take care of them to attend to things like, why is my blood pressure out of control now? Why do I have to be on 3 medicines? Isn't there anything else I can do that's not pharmacologic? And I think modern medicine needs to get smarter about the non-pharmacologic ways of managing common chronic illnesses. And for many people, that's things like better sleep, more frequent meditation, exercise of various sorts, therapy, counseling, ways of resolving conflicts with bosses or family members or friends. So there are lots of ways of re-regulating a dysregulated stress response system. None of them is a quick fix. And so there are several sections in this book about the treatment of stress-related disorders that mostly involves retraining a badly dysregulated stress response system. Well, I think one possibility there, it'll be fun to find out. One possibility is that most of the stress that we're exposed to is either good or tolerable. And it's good in the sense that it helps tune up our stress response system. And that's a kind of complicated systems issue. But there's a section in the book that talks about how the kinds of challenges that we do in our daily lives for which we have sufficient resources are good for us. You know, games are a stressor. They're a fun stressor. Eating food is a little stressful, but it's so satisfying. Exercise, sex, there are lots of good kinds of stressors that help tune us up. And as long as we get the proper relaxation afterwards, sleep at night, sitting on the couch, joking around with friends, you know, jokes and laughing is a form of stress that after which we all feel a little calmer and a little better. And so I think it may be surprising for some people to learn that most of the stress we're exposed to is good for us. It helps tune up and keep our stress response systems sort of in peak tone. Athletes and actors and performers are especially adept at it. One of the chapters in this book is called Symphony in 10 Flat by Usain Bolt. You know, for a while he was the fastest man on earth. And this is a detailed look, a kind of fantastic look at what's going on inside his body during his last professional sprint. And it's a way of understanding the magnificence of the way the stress response system rises to, in this case, an invited challenge, one of the good stressors, running a sprint in this man's glorious career. And it's an example of the good kind of stress. You know, doing the laundry or just driving your kids to school is a tolerable kind of stress, things for which we have plenty of resources and we reel it off almost without thinking. The stressors that make us sick and kill us are the unrelenting ones that we perceive as demanding us beyond our resources to match them. And these are harassing bosses, abusive parents, poverty, crime, multiple chronic illnesses, a number of adverse childhood events like being abandoned or parental separations. The list is long, and it's the cumulative burden of those kinds of stressors that move us from tolerable stress into that toxic stress zone that then sets up the development of diseases because we're trying to operate on with a stress response system that can no longer self-regulate. It can't tune itself up. And so our immune systems start to stutter. Our cardiovascular system might not be able to get oxygen to all the organs that it needs in certain times. The coronary arteries spasm or clamp down or harden. And so perfusion is less than optimal. And then it becomes a kind of vicious cycle. One illness leads to another, to another. There's a syndrome called metabolic syndrome that involves having at least 3 of 5 possible risk factors. And it's the kind of platform for people who make up a large proportion of primary care visits. And these are people who are a little bit overweight, have a little bit of high cholesterol or high lipids. Their blood pressure is creeping up. Their blood sugar is creeping up. And it's sort of a catastrophe waiting to happen. And if we wait until the heart attack or the insulin coma, then they're already in that disease zone, and it's much harder to go backwards. The message in this book is that we need to focus on early detection and earlier prevention. That's a much easier task than trying to cure somebody of their diabetes or their heart disease. So there are a lot of books about stress out there. I think this is the only book that really challenges us to translate what we can do about stress into the clinical setting. In other words, because I've spent most of my career trying to bring psychiatry into either internal medicine or family medicine settings, it's very clear to me that we need to do better in primary care settings at initially recognizing people who are on this pathway towards stress-related illnesses, and then bringing the resources to these patients and their clinicians in primary care settings that can actually influence that course and change it. And that's a big systems issue. And so part of what fascinates me about this is that there's a problem on the individual level or the doctor-patient level, but then there's also this healthcare systems level, and then there's this much larger public health dimension that we need to recognize that, about 1 in 5 of us is exposed to toxic stress at some time in our lifetimes in a way that can dramatically increase our risk for either developing or exacerbating some common chronic condition. That's a pretty sizable public health problem, and it's really worth major resources being thrown at the people who have already, just in childhood, been exposed to 4 or more adverse childhood experiences. These people have a very high risk of developing physical illnesses and mental illnesses that are going to dramatically shorten their lives or make their lives a whole lot rougher. And that, to me, is a very worthy public health target for funds, research, and innovations in healthcare delivery. So I think that one of the difficult to grasp facts about modern public health is that over the last 30 or so years, there's been a remarkable rise in the prevalence rates, the frequency with which people are developing common chronic illnesses that have one key factor in common. I'm thinking about diabetes, the remarkable rise in diabetes rates, the remarkable rise in obesity. And these really contribute to rises in the incidence of heart disease and hypertension. At the same time, rates for depression have gone up. Rates for suicide have gone up in ways that nobody has a good explanation for. Rates for attention deficit disorder. Along with this, there's another puzzling rise in autoimmune disorders, particularly among women. We don't really know what all these disorders have in common, but one of the things that we do know is that all of these have a particular sensitivity to toxic stress. We know that toxic stress increases the likelihood for either the onset of these illnesses or accelerates the rate of developing complications, and in some cases increases the rates of early death. And this is true for most psychiatric illnesses as well. And so it seems to me that the sooner we can understand how stress has this pernicious effect on such a wide range of illnesses, the more likely we are to come up with efficient interventions that can change the course of these illnesses early on in cost-effective ways. And these are not going to be simple interventions. We already know among the ones that work that it takes probably 6 or 9 months of almost daily practice to shift somebody out of the course of prediabetes, for example, or to resolve somebody's combined depression and heart disease in a way that actually reduces the risk of their progressing. And so there are some very promising treatment programs that share in common this practice of daily minding of stress levels, diet, exercise, sleep, in the context of fairly intensive social support through support groups that are focused on managing the illness of interest, heart disease or diabetes or depression, anxiety. So I think what we're learning is that our healthcare systems will need to invest in these kinds of treatment programs fairly intensively in order to be able to both reduce the suffering and also reduce the costs of ignoring the effects of toxic stress on these people who are at high risk, like these people who have metabolic syndrome. Well, I think one of the takeaway points here is that we can understand good, tolerable, and toxic stress. We can learn to understand the fascinating mysteries of the stress response system, and we can certainly do better at measuring toxic stress in a timely fashion that then will help us translate that into treatment plans that really reduce the impact of toxic stress on the course of common chronic illnesses. Because you can't live without it. It is essential to survival. Evolution has been totally focused on developing a system that is as resilient as possible and as resourceful as possible within certain limits. And the sooner we know our own particular stress response systems, because my system is just different than yours in so many ways, the sooner I know sort of where my breaking point is and where I'm particularly resilient, that's how people like Usain Bolt get to be so good at sprinters. They have a particular gift, but then they also build that gift, that particular aspect of their stress response systems for excessively good performance. In the rest of us, in our daily lives, we just need to be much smarter, I think, about where our vulnerabilities are and where our particular strengths are, and learn how to manage them well. Hard to do that if you don't have a good measurement of it. My dream is that we would all get some kind of stress profile the day we graduate from high school. A little bit like, wouldn't it be also wonderful if we had a good cognitive profile and we knew really how we learn and how we think and what kinds of intelligences we particularly have? That would reduce so much frustration, I think, for people who are confused about what they can and can't do. And the same is true of a good stress profile. Well, I think toxic stress has always been relevant. In this book, I try to highlight particularly modern forms of toxic stress. Technology has sort of robbed us from sleeping with the sun. And so we are exposing ourselves to all kinds of stimulation that leads to chronic insomnia in a large proportion of the population. And that's a form of apparently mild toxic stress. But when you think about the cumulative burden of cheating on sleep for decades, it adds up. And we pay for it sooner or later. And so, technology is forcing this issue. COVID certainly forced the issue on all of us. Our growing awareness about child abuse and childhood trauma is forcing this issue on us. It's all long overdue, but we now have the ability, I think, to measure the stress response system in a way that we never could in daily life, using wearable devices and very fancy software that can analyze enormous amounts of data, even for a single person. If you get a large enough sample over weeks and then months and sometimes years, that's a tough data analytic task. The more we can do that and do it well, the better we're going to be at figuring out whose stress response systems are in that toxic stress zone and how we can efficiently retrain them in ways that will promote good health instead of early death.